Thank you. Thank you. Good morning, everyone.
Good morning.
Welcome to another year of information on Medicare. Welcome from your insurance commissioner, James Jim Donaldson, and who's given me the permission to go around the state and teach the program, teach the book. The Medicare program is called SHIIP. It's housed in the Louisiana Department of Insurance. We are the gatekeeper for the Medicare program for everyone in the state of Louisiana. We represent you. We do not represent, we don't sell anything, we don't make decisions for you, but what we do is, you think you're alone out there, and you think that the issues you have, you don't understand. Well, there's someone there to help you, and it's called SHIIP, Senior Health Insurance Information Program. Very important that you take stock in yourself. The most important person in your life is you. And the next person in your life is your children, so we have to get them involved. So today, we're going to talk about a variety of things. It's going to seem like a lot, but here's the thing. You don't have to remember it. You don't have to even write it down. You have a brochure, you have pamphlets, you have information. My name is on the wall. I'm still ordering some calls. And you can call. You're also going to be called by signing the sign-in sheet that should be passing around. And on that sign-in sheet, my counselor will call you, and that's when they're going to discuss your confidential information. We don't discuss confidential information out in the public. But when they call you up, they're going to mention that Mr. Ron spoke over at the Women's Health Wellness Conference. And that way you can say, well, you know what? I got a problem with my ambulance bill. I got a problem with this. I have a problem with that. That's where you talk. And we're going to do our best to try to help you. In the back, we have our Deputy Commissioner, Mr. Ron Henderson. You all seen this big guy walking around. He's over 3 departments. The Medicare department called SHIIP. He's over the Diversity and Opportunity Department, as well as the Consumer Advocacy Department. Which means you have any problem in the insurance department, that's the department you'll be calling. He's here today. It's important to know that we work for you. We work for you. So don't be afraid. And I tell people downstairs, you don't have to be stressed out. How would you like for someone to tell you that if you have an issue or problem with Medicare, get you a cup of coffee, call this number, give them the information, we'll call you back? How would you like that? That'd be great, wouldn't it? Because that's what we are. That's what you can do. Because this thing changes every day. We'll give you some basic things that people don't know, and we're going to learn some things about Medicare. And I think this works here, okay? Got it? Oh, my clicker is working. Nope. Let me see something right quick. Yeah. Put it on, go to slide. Then hit, and let's see what happens there. Okay. Okay, I'll let you do it for me. Okay. We're going to start with the basic. The PowerPoint is great, but to go through it in detail, we need about almost a day. But let me show you some things. Very simple thing. First of all, and you have copies of some of this in your packet, the most important book you have is your Medicare and You book. Everybody gets a new one every year. Everyone get one? You get one every year. You know why? Because every year changes. Every year changes. When the slide was done, it's 2018. We now just got a slide just last week, 2019. So the system is behind on something. But this book is mailed to you, and everyone in the United States gets this book. 85% of the people throw it away. So if you throw it away, you don't know what's in it. But let me give you some quick lesson on how you can take control of your Medicare life and how to get your children involved. Because if they don't know, and if all the knowledge is in your head, and you're the victim, you're the patient, who's going to tell the doctor? Who's going to tell the nurse? Who's going to say what happened? So I know my mother-in-law is 95 years old, and she thinks that she has to handle her own business. Nobody can be involved. That's a big mistake. She lives by herself. Another big mistake. Because we don't determine when something will happen, when an emergency will happen, when the illness will happen. So you need to involve your children in your whole medical process. Let's start with some basic things that you're going to learn. First of all, there are 4 parts to Medicare. A, B, C, and D. Okay? 4 parts to Medicare. You can move the slide. And the 4 parts of Medicare, watch how simple this is. Everybody think it's complicated. You know what A stands for? Hospital inpatient. You can't just say hospital. You got to say hospital inpatient. Because you could be in a hospital and not an inpatient. And if you're in a hospital and not an inpatient and not admitted, Medicare don't pay the bill. So you have to be admitted. Another word for admitted, inpatient. Very important. So when you think about Part A, it's not complicated. Think about hospital inpatient. Part B, very simple. Everything outside the hospital. Outpatient. And Part D, everybody know what that one stands for. That's drugs. Okay? Now, sometimes people will say, I have Part A and I have Part B, but when am I going to get Part C? Well, you're not going to get Part C. You see? You have 2 ways you can get Medicare. And the first way you can get Medicare is you can get it to what they call original Medicare. Remember that, original Medicare. Original Medicare is A and B. As long as you pay your Part B premium, you always have A and B. So A and B is original Medicare, and it's mobile. It goes anywhere you go. But you're missing something, because Medicare pays 80%. What you're missing, that 20%. Now, unless you Bill Gates and you got it in your pocket or your checkbook, you got to do something about that. Now, if you think 100%, then 80%. There's a gap in there, right? Watch this. That difference is called Medigap, or a Medicare supplement policy. So that's where that 20% comes from. So if you don't have Medicare coverage when you retire from your job, then you have to go and get yourself a supplement. Get yourself a supplement. So now you got A and B, hospital, inpatient, B, everything outside the hospital. You got your 20% to a Medigap policy, a Medicare supplement policy, same word. What else you don't have? Drugs. So when you talk about original Medicare, A and B, you have what you call a standalone drug plan. It's standalone because it goes with original Medicare. That's the first way you can get it. If you travel a lot, and you spend so many months in Louisiana, so many months outside the state, that might be an option for you. The other way you can get Medicare is called a Medicare Advantage plan. You know it as that question that guy asked me, Part C. Medicare Advantage plan, Part C. Another name you know it as? HMOs, PPOs. Another name you know it as what? Humana, People's Health, Advantage, Blue Cross Advantage. All in the back of your book, and they're in the back of the book. Those are Medicare Advantage plans. But here's the key, they're not mobile. They're in the parish that you're in. Now, I know we have Humanas that's all over, but take People's Health, they're not all over. So if you leave your parish, you got to change your plan. So a Medicare Advantage plan is another option of how you can get Medicare. Another thing about it is, under your HMO, you have to have a primary care physician. Your PPO, you got to be in the network. When you have a Medicare Advantage plan, you must use their doctors, their hospital, and their pharmacists in the plan. That's very important, because I had a crisis last week where a person went outside the plan, didn't realize it, because the sister, the brother, the cousin, the relative told him, go here. And the bill was enormous, but he was outside the plans. They call that out of network. So another way you get it, Medicare Advantage plan. Another thing about Medicare Advantage plan, you pay as you go. So if you don't go, you don't pay. But when I mentioned original Medicare, where you have a supplement, you're going to pay that Part B and that supplement premium every month, whether you go or not. So you need to know what you have and know what your providers require of you. Study your plan. Don't just think, I got my plan 10 years ago, Mr. Brown, I got it 5 years, I'm all set. No, this thing changes every year. You know, you heard about open enrollment, October 15, December 7. But now we have open enrollment in the Medicare Advantage plan that started this year, if you have a Medicare Advantage plan starting from January to March, you can change, switch, but it's a different open enrollment. It used to be 2018 in the October 15, December 7. So when you want to know the foundation of Medicare, you have to know the foundation. This is important. Because people will say, I don't have Medicare, I got Humana. Inside of a Medicare Advantage plan is A and B, like a bundle, and a drug plan. So if you got a Medicare Advantage plan, it's against the law to have a supplement. You don't need to have a Medicare Advantage plan and a supplement. A Medicare Advantage plan is a bundle, just like I got AT&T. They got my DirecTV, they got my internet, they got my cell phone, so I got the bundle, so I get a little discount. Well, when you talk about a Medicare Advantage plan, it's a bundle. You can switch between the two during those open enrollment period and during those periods that you're allowed to, like January 1st. But the problem is, you got to be careful. Like jumping out of fire in the frying pan. You got to be careful. And people ask me all the time, Mr. Ron, what's the best plan? Y'all want to know what the best plan is? Everybody want to know that, right? You know what the best plan is? The plan your doctor take. If your doctor don't take whoever you with, whether original Medicare, whether it's a Medicare Advantage plan, or if they don't take it, and you go with one of those plans, you got to go with their doctor, their hospital, their pharmacy. Make sense? So don't get caught up. And if your plan is doing what it's supposed to be doing, and you're satisfied with it, and it's serving you, why change? You know, sometimes you say, well, I'm going to save a little few pennies over here, a little few pennies over there. But you might have to give it to your doctor. See? And now there's some new things coming out now. When you talk about the Medicare Advantage plan, they have light dental, light vision, light hearing. They have some home situation they can do now that they're doing. There's a ride. You can get a ride to the clinic. One way, 12 times, or both ways for 6 months. You have to know what your plan says. That's why you have to get your children involved. Now, let me tell you something. I'm 70 years old. I can't remember a lot of things. So I got to write things down, and I use my phone. But the problem is don't think that you have to know all of this. Don't think you can't share things with your family, because there's just so much in this. They have people that are not on medicine. They have people that are not 65, that turning 65, you're going to be talking about, that are lawyers and doctors and CPAs and you name them. They don't know what to do either. So you're not just, well, I'm old now, I'm a senior citizen, I don't know. No, because this thing has changed. One time, this was almost out of sight. In the last 5 to 10 years, the health program is the number one thing on people's mind. Number one thing. So that's your parts. And it's very simple, again. But you have to decide. And all of the programs, all of the different providers are good. Just like a fruit tree. You have to pick out off that tree what fruit you want. And make sure it fits your lifestyle, it fits your budget, your doctors is in it, the pharmacist is in it. You have to sit down and take your time. And if you feel that's too much information, dial the number. We have certified counselors across the state. We got Capital downstairs. We're going to have East Baton Rouge counseling. We have a lot of people that are being trained to help you. There's over 1 million people in Louisiana on Medicare. When Mr. Ron and I got to the department, he had 625,000. And listen to this statistic. 10,000 people per day turn 65. Per day. 10,000 people per day turn 65. And 85% of the people don't know what their plan does, what it covers, because what everybody do with it? It's like your flood insurance. You don't look at it until the flood comes. Same thing with your plan, right? So that's your basic right there. Now, something happened. What happened? This card went away. And as of this year, December 31st, 2019, everybody in the United States, in 5 territories outside the United States, doctors, hospitals, pharmacists, clinics, got to change their record. And by April, next month, everybody should have received their new card. But guess what? That's not true. They haven't received their new card. I haven't received mine. I have to call for it. And in your packet, they got 10 things you need to know about your new card. But this is going to be your new card. Why all this happened? Because on your old card has your Social Security number, the most dangerous number in the world. Scam and fraud. They removed that number, and now you're going to have what you call a Medicare identifier number. And that number, you give to your doctors, you give to your pharmacist, and they're supposed to have that even if you don't give it to them. But always remember, the benefit and the burden of proof is always on who? You. You got to do it. Don't depend on anybody to do it. Don't depend on your husband to do it. Don't depend on your children to do it. Don't depend on your caregiver. You do it. Know what's going on with it. So this new card is now in the process of being mailed out all over the country. And in the process of being mailed out, they're telling you 10 things to do, which is in your packet. 10 things to do. I'm telling you number 2, don't do. Number 2 says, throw your old card away. You remember when you had a bill and you went down, you got your money order, and you go to the store, or you write a check, you go pay that bill, and then you just throw it away, or you put it somewhere, and they come back months later and say, you didn't pay your bill. I had that happen just yesterday. Just yesterday. And the thing of it is, now you got to prove that you paid the bill. You've done everything, right? Well, if you throw that old card away and you fall through the crack, sure, in the 10th thing, you can call them up. The doctor's supposed to have your new number. The pharmacist's supposed to have a new number. That thing they're supposed to do, then you're supposed to do. But if you don't want to fall into the crack, you can say, listen, your record might not be right, or whatever the case is, I have my old card, I'll bring it for you. But if you didn't throw it away, and you thinking that everybody got everything on you, now you got to go back and make a phone call, and you can get another card. But what if you need it at that critical time? So don't throw it away. And if you haven't received your card by April, and it's on here, and if you haven't received it by the end of the year, the number down there says call. It says, number 10 says, help us. If you don't get your new Medicare card by April 2, 2019, call this number. I called it last Friday. Me. I didn't get mine. Well, they said, well, let me see. Did you move it? No, I didn't move. Well, let me see. Well, give me your number. Give me your number. Oh, well, we're going to send it out to you again. Give it about 3-4 weeks. Just saying that you got to be in charge. You the quarterback. You in charge. 10 things, read it. Again, if you forget anything, all the brochures you have in these packets, call us up. But take control. Get your kids involved. Now, you have a picture in here with your commissioner. What he's talking about, and it's in your packet. You don't have to pull it, but you can look at it. And it says what? Scams and fraud. Talking about scams and fraud. You got your new card? Yes. Did you pay your fee? Yes. No, I didn't pay my fee. But don't worry about it. Listen, your husband got his new card. No, he didn't get his either. Do you have a debit credit card? Don't worry about it. We'll just give us $50. We'll take $50 off each one of you on the card for each one of you all. Oh, well, sure. You're so happy. Somebody helping you, right? It's a scam. There's no fee. There's no cost for it. I know you get 50 million calls, but the information we're giving you, when you're in doubt about anything like that, call. The PIN that you got. This PIN that everybody has one. At Senior Medicare Patrol, SMP on that PIN. Keep that PIN. Senior Medicare Patrol, it's an organization, an agency, like the FBI almost. And if somebody's trying to scam you, if you get their name and number, which they're not going to give you, but they're going to hang up. But if you get anything, you report it, they will investigate it and prosecute. Because scam and fraud is on the rise. And it tells you right here, be aware. This is all in the bulletin. The commission is on television and radio talking about flood insurance and automobile insurance. And what we're trying to do, we're trying to make you aware that this is serious. This is serious. You know, Mark Twain said there are two important days in your life. The first important day is the day you were born. You know the second important day is? The day you found out why you were born. I found out, I'm serious now, I found out that I was born to do this. I was born to help people. That's what we're doing all my life. To help people that no one want to take the time to help. I love this. I'm passionate about this. Because my mother, 72 years old, died at 72. My father died at 76. They didn't have anybody to be there. A number they can call, talking to you. It's important because everybody that's in the United States, in the 5 territories, you don't know when you're going to get sick. You don't have the money to pay all that. Take investment in your stock. A lot of people don't know that they're turning 65. What to do? I had a gentleman, a friend of mine, he's a sheriff. He didn't know what to do. Nobody didn't know that you have a 7-month window. It's in your packet. 7-month window. Now here's how it goes. Listen to me carefully. 7-month window. And it's 3 months before you turn 65. The month of your birthday and 3 months after. You know what happens when you don't sign up for Part A in that 7-month window? You're penalized 10%, twice the number of years that you missed it. You are penalized twice the number of years that you missed it. We get calls every day. People didn't know that. Now, you know what happens if you don't sign up for Part B if you have to. Now, you don't always have to sign up for Part B if you're still working. I'm still working. I got Part A. I don't need Part B. But when I retire, decide I'm not going to work anymore, I have 8 months to go back and get Part B. You know what happens if I don't go back in that 8-month period and get Part B? What that word I said again? You're penalized again. But this time, if you let that 8 months go by, you're penalized for Part B the rest of your life. The longer you have Part B. Now here's another thing. You're supposed to have a drug plan. If you never had a drug plan when you sign up, you're penalized 1% per month for every month for the rest of your life you didn't have a drug plan. So it's important that when you're about to retire, to go talk to the business administrator, go talk to human resources. And every year, get a statement, which they're entitled to give you by law, that's saying that from January 1st to December 31st, I have medical insurance. And you're going to find out in some cases, you don't need that supplement I told you about, that Medigap, because your retired company medical plan will take care of you if you have it. I talked to a lady today that didn't have it, because they didn't put it in the system. If you don't put it in the system, if you didn't pay into Social Security, you can't get anything, right? Now, the question comes up all the time, why they penalize you, Mr. Ron? Don't you think that? You know why they penalize you? Remember, some of y'all might not be old enough to remember, but there used to be a word called layaway. See? And you couldn't afford to buy it right then and there. So you go to New Orleans to Krause. Remember Krause and Maison Blanc? And you put $10 on it, and then every month or every week you pay it, and come around Christmas, Thanksgiving, whatever, or your wife's anniversary, your husband, you go get it, right? And why you go get it? Because you didn't pay for it, right? Well, you've been paying into Medicare, called FICA, all your life, and you done did it for 10 years and earned 40 quarters. But you won't go back and get it. It's free. Part A is free. They call it premium free. If you didn't work 10 years, they have 40 quarters. But you won't go back and get it. They want you to use it. You didn't pay for it. It's not a giveaway. You didn't pay for it. It's the same thing, you know. So that's why I want to write it down. But also, there's so much good benefit in Part A. in hospital. While you're in there, they're going to pay for all that. Now, remember, you got to follow the guideline and the rule. It says semi-private rooms. It didn't say private. You can get private, but you don't have to pay for it. Semi-private. When you go to a skilled facility under Part A, semi-private. Okay? Now, Part A covers what? Part A covers hospital, inpatient. Part A covers skilled facility, but you must have been in the hospital 3 days before you were eligible to go to a skilled facility. And then you're talking about home health care under Part A. You're talking about hospice. Oh, that's a bad word, Mr. Brown. Don't say that word. Under what? Part A. And home health care is free. People don't know that. It's free. And hospice is free. All you pay 5% for respite care or up to $5 for medicines. It's just trying to keep people paying free. But all that under Part A. And when you look in the book under Part B, I call it the bomb. Part B covers so much. When you look in your Medicare new book, you have no idea how much is covered. And then something else. Preventive maintenance under Part B is free. Now, the word you got to use is wellness. You got to use wellness. And once a year, and see me, I'm a stickler. I go every year, the way I do my wellness visit, always after my birthday in September. And I go in there, and don't say your back hurt, don't say this hurt. See, I come for my annual wellness. Could be see anything else, it's the issue. This thing is so good, I'm like a kid in a candy store. I go there and I say, now wait, did I get this? Did I get this? No. The doctor say, do you want your pneumonia shot? I say, son of my wellness? And it's free? Yes, I want it. Wait. You got diabetes? Diabetes screening. Son of my wellness? Preventive maintenance? Free? Yeah, I want it. Give me that too. I want everything on the list and in your book called preventive maintenance. You know why this is so important? Because they now know what might happen. Every time I go get the oil change in my car, and I just went there 2 weeks ago, Firestone told me to say, you know what? You need to have your transmission checked. Got to change the oil up in there. You know what? Your brake pads are a little low. You know, your battery got another 2 months. What they telling me? They're telling me things that might happen that I can prepare for now. Same thing for preventive maintenance. Love it. Use it. Enjoy it. I don't like the needles, but, you know, I always say a little prayer for them needles, but I don't have them needles. But think about it is, this is for you. If your doctor takes the assignment, ask your doctor. And if they take the assignment of Medicare, this is it. What all this covers? Abdominal aortic aneurysm screening, alcohol misuse screening counseling, bone mass measurement, breast cancer screening, cardiovascular disease risk reduction visit, cardiovascular disease screening, cervical and vaginal cancer screening, colorectal cancer screening, depression screening, diabetes self-management training, flu shot, glaucoma test, hepatitis B shot, hepatitis C screening test, HIV screening, lung cancer, medical nutrition therapy surgery, obesity screening counseling, pneumococcal shot, prostate cancer screening, sexually transmitted disease infection, tobacco use cessation counseling. Yes, sir. Yes, ma'am.
Are you taking questions now?
No, ma'am. No. So here's the deal. This is all free. Now, I just told you 3 things that are free. Your home health care, free. Hospice, free. Preventive maintenance. We paying for things we shouldn't be paying for. There's another little pamphlet. And I know I'm not going about a PowerPoint because we'll be here all day. Okay? Because there's so much. That's why I say you don't have to comprehend all this. Now you know SHIIP exists. Again, Senior Health Insurance Information Program. That's you. Don't cost you nothing. The brochure, we can send you a whole truckload of brochures. You can talk to us till the sun stops shining. Because it's all free. It's about you. And see this little pamphlet here? You don't have to look at it. You'll see it. This pamphlet here is called LIS/MSP, Low Income Subsidy Medicare Saving Plan. If you qualify for this based on a gross income, all of this, all those deductions that changes every year, they're now going up. All those deductions when you go in the hospital, Part A. All those deductions for Part B. The premium for Part A, if you don't have 40 quarters. The premium for Part B. All the medicine you get might cost $100,000. And you only pay $8 for it if it's brand and $3 if it's generic. If you qualify for this based on your gross income, which when you make that phone call and my counselors call you, that's when you start talking. Now, we don't discuss your confidential information out in the public. That's why I want you to sign that sheet. That's why when they call you up and you identify, make sure who they're calling from. That's where you say, you know what, I got an ambulance bill that I thought Medicare was going to pay. Or they discharged me out of the hospital too early. Or they did this, did that. That's where all that's come in at. That's why it's important to sign the sheet. That's why it's important to get your children involved. Because you can't remember all this. I get to the office early in the morning and I read what I'm just got through telling you. I stay late in the evening sometime and I read. Emails come true. Things changes. Because we want to be available to answer questions for you. This is called like a golden key. Low income subsidy or extra help, Medicare saving plan. One side is Medicaid, the other side is the federal government that based on your gross income, see if you qualify to get help with your medicine. Biggest key, all the brochures you have, all those things you're going to read, this pamphlet here. Now, you might not qualify, but your mother might, your grandfather, but also, when you get the call, tell them about your household. Tell them everybody in your choir, everybody in your organization. Because this is about everybody. This don't care if you're black, white, rich, poor. This don't care anything about anything. But if you own Medicare and you got a health issue, there's a wealth of knowledge, there's a wealth of information that's available to you. Don't depend on nobody else to do it. You don't have to be, you know, I got a friend, he's afraid to talk. I talk all day. I talk 24 hours a day. He's afraid to talk. I'm afraid of those people. I said, you have something. I have knowledge here that I want to give you because you deserve it. You paid for it. But if you don't, in church sometimes they say, pray for me. I say, okay, what I'm praying for? Well, I can't tell you that. But, if I don't know, how can I help you? We got to communicate better. We got to work together. All these people here, it's like being in the supermarket. You pick what you want. When you got issues, we're there to help you. But please take your health serious. This is just an overview. When we talk to you one-on-one, we're going to tell you the cost that's going up on your deduction for Part A. We're going to tell you the cost that's going up on your premium for Part B. We're going to tell you the cost that's going up if you go into a skill. We're going to tell you those things. But you have to take the initiative to say, you know what? I'm going to sit down with my family now and tell them everything going on. Because what if you're a caregiver, like in my family, I was born in the family at 18. I'm the baby. I'm taking care of everybody. I got two brothers. They have dementia, Alzheimer's, and Parkinson. But you know what? People don't communicate to me. Because if they don't communicate, how can I help you? You might have your sister taking care of your mother or your father. And your sister has the Saints game in Atlanta, and your mother and father go to the hospital, you don't know nothing. But you want the hospital and the doctors and everybody to tell you everything, but you don't know nothing. So get involved. And my number's on the wall. You got all the information. I wish I had you for 4 hours. I wish I had you for 12 hours, because there's so much. But we're going to tell you that one-on-one. You see, we're just trying to make this into one quick outline. But anything you want to know, the numbers on those brochures, you call up. we're going to have people call you because you put your name on the list. But tell everybody. This is not just for you. It's not just for your family. Tell everybody you know. Go to church, your organization you're in, you know, your whatever you're around friend. You might have a friend that mother going through some issue, can't afford her medicine. You might have a friend that mother don't know she needs a new wheelchair or a new walker or a new oxygen tank, new defibrillator. You just been here today. Some of them may not be able to make it, weren't able to come today. But you can go say, we went to the women's wellness and we learned so much, and share it. This is not nothing you just keep for yourself. This is for everybody. Okay, we're going to take some questions, general questions.